All right, welcome back, everybody. We are here on the Now Morning Show right here on TTT. We're also on Talk City 91.1 FM and streaming live on Facebook at the Now Morning Show Facebook page. So that's where to catch us. Now we're going to be chatting about what we just teased at a little while ago about the importance of patient-physician confidentiality. With us this morning to ventilate that topic, it's Dr. Raman, who is in the middle here in dark colors, and also Professor Harry, who is here to join us as well as we go through that topic. Good morning, gentlemen, and welcome.
Good morning.
All right, so recently we saw that, well, I don't know if some of you all would have seen it or not, but recently there was a situation where patients' information was released via social media. And, of course, it would have raised eyebrows based on the code of conduct of doctors across the country and across the medical world. I guess, should we start by how do we define the codes of how that's supposed to work?
Okay, as you know, these are ethical issues, so there is no legal statute governing that unless somebody goes for a defamation suit. But the basic ethical tenet of any physician is to maintain confidentiality. What is confidentiality? So during the interaction with the physician, the physician asks many questions to the patient, including their financial status, their psychological status, their drug use, their diagnosis, their history, symptoms, everything. Now, it is the ethical duty of a physician to keep it confidential within themselves. Okay, there are only very few situations where they can breach that confidentiality. Those are governed by laws actually, but an ethical duty of a physician is to maintain that confidentiality. And this particular situation, you said, recently we are seeing a lot of abuse of the social media, where patient information, including protected health information, we call it protected health information, with identifiable information is being released, which is completely unethical. But if you see the recourse for it, which we can talk about, but that is the definition of confidentiality.
Well, yeah, I mean, let's get into it one time. I'm curious as to what would be the recourse.
Ramifications.
Yeah, so if, that's what I said, when I started, we do not have a statute governing that. We do have code of ethics with the medical board and secretary of the medical council. So what can happen is that, if an aggrieved person writes to the medical board, okay, and we conduct an investigation, and if found guilty of breaching the ethical conduct, a physician can be censured, reprimanded, or if it is much more grave offense, we can suspend the license. And if it is much more grave, which where it went to court and the physician was actually convicted in the court of law, we can even revoke the license. So we do have statutory power within medical council to deal with what we call as a infamous and disgraceful conduct of a physician.
One of the important issues here is that the medical board governs physicians and not the general public.
Right.
So these ethical principles, although universal, are something that physicians are bound by.
Right.
So it gets a bit more difficult to manage when non-physicians are the source of the leaking of information.
Right, because of course working in the physician's office, you would have clerical staff and you would have administrative staff and whatnot. So how is that? Is there any way to prevent them from leaking the information as well?
Any institution with a healthcare institution, right from the customer service representative, the escorts, and any level of staff, we always instruct them that this is part and parcel of a healthcare delivery, confidentiality, especially in smaller countries like this. And I was working in Barbados, but Barbados is much smaller. Yeah. Everybody knows each other. Yeah. So the first thing which we tell them, physicians, we were taught and we were brought up that way, but the others, because they just come in. So even the customer service representative, we tell them that this is confidential information, you should not do it. But unfortunately, because they do not have a regulatory council, we won't be able to do anything much more than that. But if we establish that somebody really leaked that information, we can actually take actions again.
So that would that be legal action, as in a court of law, or would that be with the medical board itself?
That's why I say the intensity of that offense is too much. So we can take like a defamation suit or breaching the the privacy of a patient, we can take action in the court of law.
Okay. All right.
Okay. And in the situation like what we have, we know the world is kind of on watch for coronavirus, and we are definitely on watch for the COVID-19 as well. In terms of information about that, so we don't want to create panic, but we want to keep the country informed. Is there a way that we should go about giving information in regards to that, in terms of if a patient was to show positive symptoms?
Absolutely, and in this particular circumstance, and the situation to which the release was actually directed, the referral letter was outlining somebody who had symptoms of COVID-19, and they had been referred from a private doctor to a public institution. Somebody along the line probably thought that they were doing the public a great service by getting this information out there, and I'm sure that that person thought that they were getting information that they felt was being suppressed.
Right.
However, a lot of things wrong with that. The entire referral letter went out with the gentleman's details, name, date of birth, address, etc. Complete travel history. In other referral letters, it can have much more private details that somebody definitely doesn't want to get out, including specific diagnoses and so forth. So we had a situation where somebody wanted to get information out and they didn't know how to do it. So they decided that sending this referral and the image of this referral was appropriate. What should have been done if somebody is concerned? First of all, if all you know is that somebody is suspected of having the virus, it means nothing, because this is flu season. It's post-carnival.
Exactly.
A lot of people are going to have viral illnesses that can have them very ill, and this was happening long before coronavirus, the COVID-19 was an issue. So if there is genuine information, first of all, there has to be trust on the part of the public to believe and to understand that the government and the health administration will not be hiding this. There will be much more to pay afterwards of details if this were being hidden.
Of
and
course.
we have to understand that. So when an actual case of coronavirus 19 is confirmed, it should go through government channels to be disseminated like that. So to the appropriate administration, if a private doctor believes that a patient may have coronavirus, they should refer them to a public institution, a tertiary care institution for testing and further management if necessary.
And the physician's responsibility is actually not to put it in social media, but they have to, we call certain diseases a notifiable disease.
Right.
Like for example, there is a chickenpox outbreak. One doctor sees a case with chickenpox. It's supposed to be a notifiable disease.
Okay.
Immediately they have to inform the public health authority, not social media.
Right.
The public health authority, that is their responsibility.
Right.
Legal as well as ethical responsibility. That is where the breach of confidentiality is allowed, personally.
Okay.
So I saw a case of chickenpox.
Right.
I called the public health officer, said that I have a case here, so they can treat it as an index case. They can see who are all the contacts, anybody else is there, whether they are vaccinated, and so on, to prevent an outbreak.
Right.
So we are allowed to call the public health authority and not post in a social
Do
media.
things to the public itself.
Of course, of course. Well, we live in an age of social media, and we always need to be mindful of it as well, and mindful of our responsibilities. So thank you, gentlemen, very much for coming and reminding, all physicians and the general public about what the rules of engagement are. So I want to thank you guys again for coming and sharing this information with us, and we look forward to making sure that we keep our doctors and physicians in check.
Thank you for the opportunity. Thank you.
Thank you very much, gentlemen.
All right.
All right, we are going to take a short break and come back with much more, so stay with us.